Hello everyone. In this episode I will be talking to you about how to take a patient's clinical history. Taking a good medical history requires a good structure. With this, it is difficult to miss out vital information. I will talk you through how I take a patient's medical history and I hope it helps you. As always, it is very important to introduce yourself to the patient and explain why you're taking a history. All the information obtained from a clinical history remains confidential, and it is always important to reassure the patient about this. I will go through 5 main sections that I use to complete a patient's clinical history. We will start off with the presenting complaint. This also includes the history of the presenting complaint. It's important to lead with an open question, which helps the patient expand on their presenting symptoms. This includes things such as the onset of symptoms, the duration of symptoms, and the timeline of events of how things have panned out in the patient's perspective. It's also important to ask about red flag symptoms. These are signs or warnings of a potentially serious condition. This includes things such as a fever, unintentional weight loss, a change in bowel habit, or blood from any orifice, be it the mouth, the back passage, or the waterworks. An example would be a patient who's presented to you with chest pain. I use a popular mnemonic called SQUITARS, which covers a good pain history. S stands for site of pain, Q stands for the quality of pain, get the patient to describe what the pain feels like. I stands for the intensity of the pain. I often give the patient a pain scale of 1 to 10, 10 being the worst pain they've ever felt, and ask them to rate the level of the pain they're experiencing. T stands for the timing of the pain. When exactly does this pain come about? A is for any aggravating factors that make the pain worse. R is for any relieving factors that make the pain better. The second R is for radiation. Ask if the pain travels or radiates anywhere else. And the last S is for any other associated symptoms that come alongside the pain. This will help you take a detailed pain history for any patient presenting with pain, regardless of where it is. The next section will move on to the past medical history. In this section, it is important to ask about previous medical diagnoses, any medical comorbidities such as hypertension, hypothyroidism, osteoarthritis, rheumatoid arthritis are all relevant. You must also ask about previous surgical conditions, so any history of operations in the past are relevant. For instance, a patient presents with abdominal pain. If they've had a previous abdominal procedure done, for instance an appendicectomy, this is important to know because patients such as this develop scars and adhesions which form a common feature of causes of bowel obstruction. Also ask about the patient's regular drug history, so any regular medications that they take prescribed, bought over the counter, or taken recreationally. It's important to also ask about any allergic reactions that they may have to any drugs known to them or any other substances known to them. In particular, don't forget anesthetic medication if they've had previous surgery, because it's important to know if they react to any possible anesthesia. Try and gauge the level of the reaction, so ask about the specific nature of allergic reactions. Is it mild or is it a severe anaphylactic reaction? These are all important to know. We will move on to the third section, which is the social history. Think of it as the patient's lifestyle and the effect of the patient's environment on them. This will also include the family history. Ask about any conditions that may run in the family that will put the patient at high risk of developing certain conditions. Ask about the patient's living situation, so find out if they have any support at home and the previous mobility status, because this will form an important part of your discharge planning. Ask if they have any pets and their previous or current occupations. These are important, for instance, in respiratory conditions such as interstitial lung disease. Ask if they have any birds at home, which can cause a condition known as bird fancier's lung, or any previous exposure to asbestos. It's important to also ask about the smoking history and alcohol history, because these are important risk factors for developing certain conditions. Ask about any recent travel history, because that's important in figuring out if they've had a recent period of immobility, especially in long haul flights, which can put them at risk of developing a clot such as a deep vein thrombosis in the legs that could potentially have a serious complication of a pulmonary embolism, which is life-threatening. The fourth section will be your systems review. In this section, feel free to ask any other questions relating to the history of presenting complaint that you think you may have forgotten to ask about. However, this section is meant to cover and highlight any other possible symptoms related to other systems in the body. Going from top to toe, start with the central nervous system. Don't forget the cranial nerves. Move on to the cardiovascular system, and then on to the respiratory system, the gastrointestinal tract, the genitourinary system. Move on to the musculoskeletal system, the skin itself, and any other neurology. The fifth and final part of your history taking will be the summary, which includes ICE. ICE is a mnemonic which stands for the patient's ideas, concerns, and expectations. This is particularly important because you want to know what the patient's main worries are and what they think is going on, because this can form a major part of your management plan in view of the holistic approach of treating your patient. It is also useful to summarize all you found from your history taking process in order to clarify that you have all the accurate information provided to you by the patient. Leave some time to give the patient a chance to ask you questions, because that might reveal some new and important information to you. This will complete your history taking. Please remember that history taking is a fluid process. A structure is only there to guide you so that you don't forget any vital information. Practice makes perfect. Stick to any structure which suits you and develop your skills based on that. If you would like to see an example of an actual consultation, please feel free to leave a message in the comments below or drop me an email, and we will be able to arrange that for you. I hope this helps you. Keep practicing, and good luck.